a majority could not access the mental health care they desired. "91% of transgender and non-binary youth said that they are worried about transgender people being denied access to the bathroom due to state or local laws. 63% of queer youth reported that they have experienced discrimination based on their sexual orientation or gender identity. I want to make this too long. LGBTQ youth reported that they are threatened with or subjected to conversion therapy. Conversion therapy has been consistently associated with negative mental health outcomes and greater risk of suicide. That is why so-called therapy is widely opposed to by all major medical and mental organizations, and why it is a major focus of the Trevor Project's advocacy work. Emmett Paley. LGBTQ youth who lived in or an accepting community have had access to LGBTQ affirming spaces or felt high social support from their family and friends and educators reported significantly lower rates of attempting suicide in the past year. Those who live in places that is accepting queer people reported slightly lower rates of attempting suicide compared to those who do not. Nearly 2 in 5 queer youth reported living in community that is somewhat or very accepting of queer people have reported lower rates of suicide. Senior research scientist of the Trevor Project, Misha Price, said, "These findings emphasize the wide range of experiences and identities held by LGBTQ young people across this country, as well as the clear need to break down barriers to care and promote acceptance at the local level to help save young people's lives." Young queer people feel happier whenever they find someone who is like them or accepts them. It helps them overall. Emmett Paley, the CEO and executive director of the Trevor Project, also said, "The fact that very simple things like support from family, educators, and friends, seeing LGBTQ representation in media, and having your gender expression and pronouns respected can have such a positive impact on mental health of a queer young person. It is inspiring and should command more attention in conversations about suicide prevention and public debates about LGBTQ plus inclusion." I believe that queer youth, like myself, should be able to access treatments, medicines, and therapies they need or want. The school education system teaches us that it is bad and that we are not mentally well. We are also shamed and misgendered and dead-named, which can cause people to have mental blocks or have mental problems which can mentally hurt them. Many transgender or non-binary people deal with dysphoria, which can hurt a person mentally and physically. We should, as a community, provide support for them, like providing the health care they need, and hormones and therapy if they want it. some people move to more dangerous ways to get what they need or want, such as the black market or other dangerous ways, which some people have turned to. The Trevor Project has been working on proving this and helping this law be put down for years, since before it was made, and trying to help queer youth get the help they need and want and deserve.